Dr. I Am Jumpy has ordered heparin subcutaneous that will take out of this ampule for a patient Skip Rocker, date of birth of 1/1/72. The first thing that I'll do is I'll check the physician's order and the patient's MAR to make sure that it's the right medication. I will make sure that I check the patient's 6 rights, which is right patient, right medication, right dose, right time, right route, and of course, right documentation. I will stress the importance of washing my hands before pulling out the medication and before administering the medications. So I'll go ahead and wash my hands. I want to check the vial to make sure that there's no cracks in it and that the expiration date is still good, which our expiration date is 1/25. So it's still good. I want to make sure that all the medication is out of the top part of this, and so that's what I was just doing right there. And it's in the bottom. So I'll go ahead and break the top, and I want to use some gauze, and I want to make sure that I break this away from me like that. And we'll just set that there. And I'll grab my needle. And I have a 1 ml syringe. And I want to take my normal needle off the top of this and just set it down here, because we will be using that later. But you want to use a filter needle to pull out this medication, as we want to make sure that no glass shards get into the syringe. All right, so now I'm going to go ahead and I'm going to pull the syringe back to 0.7, because we want to have 0.2 milliliters of air in the syringe. So I'm going to go ahead, or I want it at 0.2. And I'm going to go ahead and pull it back, the medication, to 0.7 again, because I want the 0.2 mils of air. All right, so then I want to put my my regular needle back on and discard my ampule and my filter needle into the sharps container. And I'll prepare everything that I need to go into the patient's room. So I'll have my alcohol swab and my gloves. Okay, so going into the patient's room. Knock, knock, knock. Hello, Skip Rocker. I want to verify his name and date of birth. I want to, of course, pick the right site. And for heparin, it's best to put it in the abdomen. So I would put it in his abdomen, and I'd want to pick a spot 2 inches from his umbilical, or his belly button. And then I would, if one side is more bruised than the other, I would want to pick the less bruised side. I'd wash my hands, and I'd put on some gloves. And we'll take the alcohol swab. And again, I'd pick a spot 2 inches from his belly button, and I'd want to pinch it with my non-dominant hand. And so I would take my alcohol swab and go in a circular motion, starting from the inside and go out. And I'd let that dry. Go ahead and take the cap off my needle. And with my non-dominant hand, pitching the skin And I'd want to go in at a 90-degree angle, go straight in, and I want to hold the syringe and needle with my non-dominant hand, and I want to slowly administer the medication. And they now say that if the slower you administrate it, like over 30 seconds, the less chance of like bruising there is. And we want to administer all the medication and the 0.2 amount of air that we have in the syringe, and that because that helps it just seal the medication into the skin. All right, so then we'll go ahead and pull it out, and I would dispose of my syringe and needle into the sharps container. I would go ahead and document the location and the medication that I administered into the patient's chart.